Hello, friends, and welcome to another episode of The Ingredient Guru. And today we are talking about something that most of us don't think about as in depth as we're going to get into today. I've already learned some stuff before we even got on that has me eager to know more. And we are going to be talking today about how our muscles and our bones are actually best friends. They each have their own system, but we need to work with them, especially as we age, to make sure that we are strong, vibrant, and healthy. And so today I am speaking with integrative medicine OBGYN, Dr. Jennifer Roelands, who is just going to clue us in to what we need to know about our muscles and our bones to age well and be healthy. Jennifer, thank you so much for being here.
Thank you for allowing me to be here. It's an honor.
And so I love the fact that you say that you are an integrative OBGYN. Can we talk for just a second about what that integrative word means?
Yeah, perfect. Integrative really is complementary medicine and traditional medicine blended together.
Hmm.
I describe it to patients that your doctor that you've seen, your primary care doctor, has a certain set of tools. I just have a bigger toolbox. So my toolbox is just much bigger. It incorporates nutrition, lifestyle, stress management, it incorporates mind-body medicine, herbals, supplements, acupuncture. Like, it just has more tools, so that there are patients who do really well in the traditional route and patients who are like, you know what, my doctor tells me everything is normal, but I don't feel normal. So that's
Hmm.
the type of patient that really integrative medicine is beautifully suited for, because we can dive deep into, let's look at what's actually going on. Because in my mind, traditional medicine, we're very much stuck on diagnosing disease. Like,
Hmm.
for lack of a better way, ignore things until you get a disease, right? Like, you don't really have an issue until my test says you now have a diagnosis. But in integrative medicine, we're really looking at root causes. What is leading up to this factor? Why do you feel so fatigued and can't do what you used to do? There's some reason that's building up to it. You don't have a diagnosis, but that doesn't mean you don't want to feel better. So in my
Right.
mind, integrative medicine is really this complementary and traditional blended together.
And I love that because I know not only from personal experience, but from clients that I've worked with as a nutrition educator, there are so many times where you don't feel right. And you go to the doctor and they're like, "Oh, your tests are fine." It's like,
Yes.
I feel like crap. And
That's my entire clinic.
and so knowing that there are other solutions out there is just really great. And I also am really excited to talk with you because you shared before we got on that muscles and bones are best friends. And so I want to know more. Talk to us about that.
Yeah, and along that same sort of integrative model, we look at the body as a whole. In integrative medicine, the body as a whole. You really don't have one system that just functions completely by itself. They're all connected. If you have something with blood sugar problems, it means that you also may have a thyroid dysfunction, which means you
Mhm.
also may have muscle issue, which means you also may have brain health problems, because it's not one thing. It's this little center piece, and then all these spokes are coming off and they're all interconnected. And so muscle and bone too, they literally are next to each other like best friends in most of our body, but they so much affect each other because they both have their own sort of like metabolic needs, their
Mhm.
own. When you work out, you break down muscle, you have to rebuild it. You also break down bone, you have to rebuild it. So they are have a very synergistic way that they function on their own, but also needed. You can't just go to the gym and isolate your bone. It's not going to happen. Like, it needs, you have to have your muscles. Even sitting in my chair, they both have to be intertwined. And then we don't want to forget about their little cousins, the tendons and the ligaments, that also come together to make them hang out together, essentially. But they are, while they have their own systems for metabolism and for breaking down and building, they still are intricately involved together. This is why this comes up with aging. As we age, we have both our muscles and our bones that are affected by the changes as we age.
And when it comes to making sure that we're supporting the muscles and the bones as we age, what are some of the top factors that people really need to pay attention to? I know we all know about diet. We want to eat well to be well, but, and quite frankly, that can always use some improvement. But I know there are some other factors that we need to take into account as well to make sure that we're supporting them so that our body can continue to allow us to have strong muscles and bones. What would be some of the things we have to pay attention to?
Yeah, so the gurus in longevity medicine, I'll throw out this resource. There's a great book called Outlive by Peter Attia. And if you want to just nerd out on the science of aging longevity and really actually get into what's so fabulous about that book, and I don't have any like affiliation, I don't get any credit for this, but the book, what's so great about it is it literally goes up over the types of exercises that really move the needle as you age.
Mm-hmm.
So we hear all the time on Instagram and all these places, like, make sure you do 30 minutes of here and an hour of yoga and 2 hours of HIIT and 30 minutes of this. It literally, that book dives into the science, like connecting these people on different varieties of athletes. It doesn't have to be Michael Phelps type level athlete, but literally trying to show you the data behind why certain activities that you do will change your longevity scope. Is HIIT a good idea? Is resistance training a good idea? What are the things that, and even to the level of where you can actually measure them with a lot of this AI technology to understand, am I actually getting myself to the level that in the book, he talks about a decathlon. Every person should come up with a decathlon of things that they want to accomplish, right? They want to have, here's my list. I want to be able to walk 3 miles without getting short breath. And a lot of those are related to exercise. So what are those goals that you see for you? And then can you actually make them happen at a certain age, which is interesting. But the basics of everybody, the basics, you always have to go back down to the kindergarten thought of, let's go back to kindergarten. The number one thing for everybody is you have to move.
Yeah.
You have to move. So we all have set up our lives to be much more stationary than our grandparents did. We don't have gardens all day. We're not doing a lot of those things. We're literally sitting on our phones when we get home, watching Netflix, doing all these things that are very stationary. So if you don't have a very active lifestyle, the very first goal would be just move and move in a way that makes you happy. Because if I told you, I want you to go do HIIT 2 days a week, and I want you to do resistance training, I want you to do yoga, and you look at me and say, I hate HIIT, I hate yoga, you're not going to do it.
Yeah.
So if your version of moving every single day is gardening, great. If your version of moving every day is chasing your kids, great. If your version is going and doing water aerobics and having those lovely ladies boss you around in the pool, because there's always the older ladies that boss you around in the pool and yoga and water aerobics. That's why I did that for a lot of the years, because like they would just boss me around. It was great. Like, then do that. That's, I would say, the basis of the whole paradigm is first move your body. And move it as much as you can.
And one of the things that is so fabulous about your saying that is there is no one size fits all for everybody. Because if there was, we would all be doing it. And like you said, I have friends who are marathon runners and triathletes, and I just look at that and go, no, but I will happily do like a 5K mud run. I just learned that last year, or this year, actually. I did my first one. I'm like, oh, I'm doing another one. And finding what it is that works for you in order to help you is such a great point, because I think too many of us get caught up in the should. If you want to have healthy bones or a healthy heart or a healthy insert body system here, you have to do X. They say you have to do so much cardio every week or so much or whatever. And so are there some truisms as to how much you really need to move your body, or is it just in general move?
No, I think the basics start there. And then if you want the textbook answer is 150 minutes a week, 75 minutes of hard intensity exercise. And it's not specific about the type, right? Hard intensity could be hot yoga for me, it could be HIIT for you. It could be someone who's not mobile at all, and them walking a mile is hard intensity, elevates their blood, elevates their heart rate. 150 minutes weekly is like the textbook answer. But when you go from the basics, then you really get into what is effective in let's talk about women in particular. What's effective and what's very useful for women is resistance training and cardio, a combination of resistance training and cardio. And they're very effective for a couple of reasons. One, blood sugar regulation. As we age, our lovely estrogen decides to go away. And that is, I talk to patients and say, estrogen to me is like the bossy aunt in your family. Everybody has one aunt who is in everybody's business. She knows everything about everybody all the time. Yes. And so when estrogen, and so she regulates blood sugar, she's intimately involved with blood sugar. She's intimately involved with bone health. She's intimately involved in muscle health. She's intimately involved in brain health. And when that bossy aunt decides to leave the family, then you get in trouble. And so it causes insulin resistance issues as we age. It causes muscle mass loss as we age, causes bone health turnover to not happen as effectively. The spring cleaning aspect doesn't happen very well. She's also responsible for helping with the fluid in our joints. So people notice as they go through menopause, they get achy. They wake up and go, what is this? Did I do something last night? What did I do? What's up with that? And then they move around. They're a little bit better.
Oh, is that why they get crunchy too? Because I've noticed like my knees are way more crunchier than they used to be.
Yeah, less fluid. And also those ligaments are a little bit not quite as firm, and everything else that has the collagen aspect, right? In our, it mirrors inside and out, where we're like, what's going on with this thing? And that's the thing that happens with your ligaments, and your tendons don't have that collagen. And so it just starts to become like more of a grind on your joints and a little bit more achiness in your muscles. And so when those things happen, you have to the best way to counteract that is resistance training. Helps build muscle, helps encourage bone to turn over and to use because it needs a higher metabolism, right? So it's going to go, okay, let's get rid of the bad dudes. Let's spring clean and put some nice stuff in here because we really want good bone. She keeps working out at this gym. We need to do something about it. And then it also and cardio obviously is good for brain health and heart health and decreasing cardiovascular risks because we don't have estrogen anymore to make our vessels so pliable and they become a little more harder. And resistance training and cardio is the like formula as we age for women, especially, and men too. Men do have decline in testosterone. They just don't have this sort of like aspect. There's a little bit like a 20-year drop curve. So the cardio and resistance, and those can be within those categories. There's a lot of different ways to do resistance training. Some people literally lift weights. Some people like TRX, or they like Pilates with like low weights. Some people do resistance training where they're doing band work. There's a lot of different ways to do resistance training, isometric exercises. And then cardio also can be done a lot of different forms too. It doesn't mean running. It could be swimming. It could be faster walking. It could be hot yoga. It can be very hard cardio inducing. So there are a lot of
walking up and down stairs can be cardio.
Doing stairs. That's what I did this morning. I went to the high school and I was like doing the stairs. And I love doing it because there's this super cute little 70 couple in their 70s that like have zero out of breath. And they just chat the entire time. And I look like I'm dying. I'm like, excuse me, can you move? And they're just like, that. It just, so it pushes me because I'm like, I want to be like that in my 70s to have a 40-year-old behind me, like dying. And I'm like, ain't no thing. Like, I got this.
That's awesome.
Great. Stairs is a fantastic option. So there's just a lot of different ways to make that work. And so resistance training, minimum of 2 to 3 times a week, and then cardio 2 to 3 times a week, depending on if you're flipping them and saying, I'm more of a cardio person, I'm more of a resistance training person, however it works in your life, basically.
That's great. And I think one of the other things too that it sounds like can be really helpful for people is if you have a setup that works for you, either you go to meet your 70-year-old buddies there, not that you're best friends and you're in conversation with them, but having people who can help you stay on track is also a really good thing. I think we tend to have a lot of good intentions, but then they fall by the wayside if we're solely responsible for it. Do you have any thoughts on that?
Yeah, I think the biggest thing I hear in my clinic is people say, I just don't have the time. I can't make it work. And so you do have to be creative. I worked with a patient who is a truck driver. So she's on the road 10-hour slots at a time. And she's gone for a week or two and then comes back. And so we were like, how can we make this work? Tell me your schedule. And so after talking to her, she said, I'm required to stop after 2 hours and sit in a truck stop for 30 minutes. I said, what's the truck stops are just like these big grass areas, right? With like food and all that. She goes, yeah. I go, why don't you just walk for 30 minutes? Why don't you just walk, pace around there for 30 minutes? And you have to do that twice in your shift or 3 times in your shift. And then you'll get your exercise in. And she did. She lost 10 pounds in 2 months.
Wow.
Because what she was doing is sitting at the truck stop, having coffee, then having a little snack. So she wasn't realizing that she actually had an opportunity to use that time. It just, in her mind, she just thought of going to the gym as like what that means by working out. And it was like, this is a completely great option for you to just walk around. Like, why not? You've been sitting for 2 hours. Why not walk? And there's always ways to make it work. Like me, I don't have a gym membership. I went to the high school. I did my up and down stairs. Like, you just make things work in your schedule that you can do, that you enjoy, that'll be able to work within that schedule. I had one lady who has 9 kids, and we actually did a weight training program. She's in her 40s, where she actually has a 2-year-old. So she sits on the floor and she lifts her 2-year-old who's 30 pounds. And we did a whole program we developed on lifting your 2-year-old. The 2-year-old thinks it's great. They laugh. She showed me, it was like hilarious. The kid's like laughing. She loves it. I'm like,
That's
we
hilarious.
can make this work, right? Like, your kid's 30 pounds and it's at your house all the time. Like, let's make this work.
Those are some really creative solutions. And what a great idea to find either those moments of confetti time or a way to incorporate it into what you're doing. That's just really creative and wonderful. Thank you for sharing that. This has been amazing. You've just shared some really great information. If someone wanted to connect with you to learn a little bit more about you or what you do, where would they find you?
Yeah, so my clinic is called Woman MD. And so I have a website. I'm also on Instagram. And then TikTok, I'm actually the holistic gyno.
Wow.
And then I do have some things on YouTube, although I don't focus as much on there. So my website is probably the best way to reach me. That's where I see patients. I'm not licensed in 9 states. So I see a lot of patients by telehealth. And then I also am seeing patients in person in California, Orange County.
That's great. Jennifer, thank you so much for being here and for helping us understand why we need to keep moving as we age if we want to keep moving. Folks, thank you so much for joining us today. And I know you learned a lot and hopefully got some great ideas or got those wheels spinning as to what you could do to find space for resistance and cardio in your everyday. And I'll put all the links down below. So make sure to check those out. And in everything you do, make today a healthy day. Bye, folks.